Singapore may see a flu resurgence as pandemic curbs are eased. A combined study by SGH, KKH and the Genome Institute of Singapore has found that flu cases went down significantly last year because of measures like mask wearing and the circuit breaker. But this could change with the peak December flu season just around the corner. Well, to tell us how worried we should be and how to protect ourselves, we're joined by Dr. Esther Tan, consultant at SGH's Department of Respiratory and Critical Care Medicine. Dr. Tan, are we likely to see a resurgence in respiratory virus infections? And we're all still wearing masks and safe distancing. So how does that factor in?
Yes, there definitely is a concern that we will see a resurgence in influenza infections this year and into early next year, which is one of the two typical influenza seasons that we actually see in Singapore. The study that you mentioned just now, led by a group of physicians with Dr. Wan Wei-Yi from SGH and Dr. Matthias from KK Hospital, they have indeed reported a reduction in respiratory virus infections compared to pre-pandemic numbers. And one of the viruses that they studied was that of the influenza virus. It is postulated that this reduction in numbers is due to restrictions that were placed on travel, social distancing measures, work from home initiatives, personal hygiene, and definitely with mask wearing. But with gradual relaxation of such restrictions, including the newer travel regulations, there is a likelihood that we will see, unfortunately, a resurgence in influenza rates.
And Dr. Tan, is there a possibility of contracting both the flu and COVID-19 at the same time?
Yes, there is definitely a possibility of co-infection. Although we have yet to see any such cases here in Singapore, internationally, such co-infections have already been reported.
And when we see these co-infections, how serious do they tend to be? Are there complications that we should also keep in mind?
Yes, it can be serious, especially in individuals who are elderly or those who have chronic health problems. So, for example, the symptoms for both influenza and COVID can be similar. With co-infections, these symptoms such as fever, feeling very lethargic, body aches, respiratory tract symptoms, all these can be aggravated. And especially in individuals who are elderly or more frail, with health, serious infections can occur, resulting in lung infections. And with that, these individuals may require hospital admissions. They may require oxygen therapy or even use of machines for breathing and intensive care management. All in all, the outcomes can be worse with regards to hospital lengths of stay as well as mortality.
And Dr. Tan, doctors like yourself, we understand, are recommending that people get the flu jab. How safe is it to take it alongside the COVID-19 vaccine and booster shot? Anything we should be mindful of?
Yes, so definitely the influenza vaccine is recommended for all individuals who are 65 years of age and above, and for younger people who have chronic health problems or for pregnant women. The COVID-19 vaccine as well as the booster jab can definitely be taken alongside the influenza vaccine, although we tend to recommend a 2-week interval between each.
All right, Dr. Esther Tan, a consultant at SGH's Department of Respiratory and Critical Care Medicine. Thank you very much for your input.